Hello everyone, myself S. KAVIYARASAN, tutor from Sri Venkateshara College of Paramedical Sciences, Erode, India. Before starting my presentation, I would like to thank Inti International University for giving me this wonderful opportunity to present my work. Let's begin. My title was Effects of Progressive Aerobic Exercise along with a psychobiotic rich diet on anxiety and quality of life in adults with obsessive compulsive disorder. The introduction. The obsessive compulsive disorder affects 2 to 3% of the global population and ranks among the most disabling mental health conditions, which is characterized by the intrusive obsessions and repetitive compulsions. OCD significantly impairs quality of life across multiple domains, including work, social relationship, and family functioning. Despite advances in treatment, including cognitive behavioral therapy, which is CBT, and the selective serotonin reuptake inhibitor (SSRIs), many patients experiences incomplete symptoms relief with treatment-resistant rates remaining substantial. And research consistently demonstrates that individuals with OCD report significantly lower quality of life compared to healthy controls, which affect sizes ranging from moderate to large across the different life domains. And then the psychological burden extends beyond the symptom severity, and elevated stress levels and cortisol dysfunction commonly observed in the population. And then Abrantes et al. Conducted a first RCT comparing the aerobic exercise to health education control and the conditions in 56 patients with treatment resistant OCD. While both groups showed an improvement, the exercise group demonstrated superior outcomes with 30% of achieving clinically significant improvements compared to the 7.7% in the control group. And then the concept of psychobiotic. It was the live organism that confer mental health benefits through the gut-brain axis modulation has gained significant attention, while individual probiotic strains show promise. Whole diet approaches targeting the microbiome offers a great ecological validity and then the clinical applicability. Before starting my aim and objective of the study, I have to brief that what the table I have mentioned above the aim and objective of the study is. Here we go. These all about why I have included progressive aerobic exercise instead of any kind of particular aerobic exercise. Let's see. These are the two exercise interventions, aerobic exercise interventions I have included. First one is a moderate intensity aerobic exercise, and then high intensity interval training. In MIAE, where the anxiety reduction is high and immediate, and then in HIT, it can be variable, canvas, acute anxiety. The tolerability also, which is high in moderate intensity aerobic exercise, especially in OCD, and then moderate to low in anxious patients. And then what about the adherence rate? It was also high in MIAE, and then lower due to aversive sensations in HIT, and as well as the safety also. That's why I have given the progressive aerobic exercise, which is they have initially I going to start with a moderate intensity aerobic exercise and then get progress to high intensity interval training. Now let's come to aims and objective of the study. To determine whether a progressive aerobic exercise protocol MIAE transition into HIT alone or combination with a psychobiotic diet provides superior improvement in anxiety and quality of life for adults among OCD compared to a single interventions or controls. And let's come to hypothesis, null and alternate. The null hypothesis, there is no significant effect of progressive aerobic exercise combined with a psychobiotic rich diet on anxiety levels and quality of life in adults with obsessive compulsive disorder. Alternate hypothesis, there is a significant effect of progressive aerobic exercise combined with the psychobiotic rich diet on anxiety level and quality of life in adults with obsessive compulsive disorder. Methodology. My study design was parallel group randomized control trial, and my study population study was conducted on mild to moderate obsessive compulsive disorder, which is OCD. And the study setting, this was a multi-center conducted at IRT Perundari Government Hospital, and it is affiliated clinic centers across Erode district, Tamil Nadu, India, to ensure participants diversity and improve the generalizability of findings. And then sample estimation. The sample size was estimated using G-Power software version 3.1 and for one-way ANOVA with 4 groups with a large size large effect size of f is equal to 0.40 and the significance level of 0.001. The required sample size was 76 for 80% of the power. To ensure adequate power and account for dropouts, 80 participants were included in the study, where 20 per group. And then the sample size. The sample size included 80 subjects. And then the sampling technique. We have used stratified random sampling technique, where I need to explain this much more. Let's see the inclusion criteria. Inclusion criteria, I have mentioned that 18 to 45 years. By this 18 to 45 years, if we directly use some other sampling techniques, we may experience the expectation bias over the study. So to prevent that, I have used stratified random sampling technique. In stratified random technique, I have separated two age groups. One is 18 to 25 years and then 26 to 45 years. But equally, I have taken the subjects, so that I included in all groups, which is 20 subjects. I have divided into 4 groups, which is totally 80 subjects. And then the study duration. The study was conducted for a period of 6 months with 12-week treatment duration for all the group. The selection criteria. In selection criteria, we are going to see the inclusion criteria. The inclusion criteria were the adult aged 18 to 45 years, both male and female, and who is diagnosed with obsessive compulsive disorder as per the DSM-5 criteria confirmed by psychiatrist at KIT government hospitals. And then the Weibucker score, indicating the least moderate severity. And then the medically fit participant in moderate intensity aerobic exercise based on the physician clearances, and then who's willing to adhere to psychobiotic diet or any assigned interventions. Exclusion criteria. We have excluded the comorbid psychiatric disorders like schizophrenia, bipolar disorder, and substance uses, and the use of antibiotics, probiotics, and microbiota influencing supplements in past 4 weeks, and then GI disease, food allergies, or dietary restrictions incompatible with the psychobiotic diet. And then the cardiopulmonary or musculoskeletal conditions limiting aerobic activity, and then the pregnant or lactating women, and then the psychotropic medicine started adjusted in past month. And then we have followed a single blind parallel group design, where the participants were blinded to their group allocation to reduce expectation bias. All outcomes assessments were performed by using standardized instruments, and the data were analyzed by statisticians blinded to group identities to ensure subject objective, and also for outcomes assessor to minimize the analytic bias. And then variables of my study. The first one, the independent variable, the progressive aerobic exercise, which is the moderate intensity aerobic exercise, followed by high intensity interval training, which is the HIIT, and the second one is the correlated psychobiotic diet. The dependent variables are anxiety and quality of life. These are my dependent variables. And then the group allocation. I have taken 4 groups, which is the group A, who is following the moderate intensity aerobic, is followed by HIIT plus psychobiotic diet, and group B only follows HIIT plus psychobiotic diet. Group C only follows MIAE, which is the moderate intensity aerobic exercise plus psychobiotic diet, and group D only, it was a control group, so it only follows the psychobiotic diet. And each group, the 20 subjects were given, equally distributed all across the 4 groups. And then outcome measure to improve quality of life and to reduce anxiety levels. Statistical tools. We have used over n number of statistical tools over here, which was framed by me, and was calculations were done by proper statisticians. And then first one was the chi-square. This chi-square test was used to analyze the categorical demographic variables, while one-way ANOVA is compared to continuous variables across the group. And then the paired t-test for intergroup comparison. And then one-way ANOVA. For one-way ANOVA, we have used a software called a statistical package for the social sciences. It is used to compare the difference between all 4 groups. And then the Cohen's t to evaluate the magnitude of intervention. And then the Pearson correlation was used to assess the relationship between the anxiety and quality of life among participants. And then the Spearman correlation was used to compare the relationship between the anxiety and quality of life across all the groups. My outcome measures are the World Health Organization quality of life scale, which is the 26 item version, and then the Beck anxiety inventory. These are my outcome measures. Let's move to exercise and psychobiotic diet interventions. The general structure for all exercise groups were A, B, C. The frequencies were 4 sessions per week and the duration was 12 weeks and supervised by certified physiotherapist. There is a warm up and cool down period over here. And we have monitored the patient during their exercises, that is box or PE scale, and then heart rate max calculated as 220 minus age, and the psychobiotic level was framed by dietitian and nutritionist, and it was approved by a gastroenterologist. After getting approval only, we have methodology. Group A, the moderate intensity aerobic is followed by high intensity interval training along with the psychobiotic diet. Previously, we know that if initially we have given the high intensity interval training, means it may worsen the anxiety symptoms. That's the reason why we are starting with MIAE, where which is mentioned as a phase 1 and phase 2. Phase 1 has a MIAE and phase 2 has a high intensity interval training. The MIAE goes from week 1 to week 4. The type where treadmill, walking, cycling, and the duration where 30 minutes per session. The intensity 60 to 70% of the heart rate max, which is the moderate one, and progression increase the speed or incline weekly as tolerated. And then phase 2 where the high intensity interval training starts from 5th week to 12th week. The type ergometer or treadmill. The intensity is 4 sets and 4 minutes high intensity at 85 to 90% of heart rate max plus 3 minutes recovery, active recovery at 60%. And then the group B, which is we only given the high intensity interval training along with psychobiotic diet. There is no MIAE phase, which is the moderate intensity aerobic exercise phase. The type where cycle, ergometer or treadmill. They start from week 1 till week 12. The same protocol as Group A phase 2, and the intensity is 85 to 90% of the heart rate max intervals with 60% recovery, and the frequencies were 4 sessions per week. And then for Group C, we have only given the MIAE only along with psychobiotic diet. The type was treadmill, walking or cycling, and the duration was 30 to 45 minutes per session. The intensity was here is 60 to 70% of the heart rate max, and the frequency is 4 sessions per week. And the progression were gradual incline and speed increase over the weeks. For further information, we have to look into Group A's protocol. And then Group D, which is only the control group, and only have provided the psychobiotic diet only. There is no exercise intervention, revised standard psychobiotic diet guidance. And then we are asked to maintain a daily routine activity, the probiotic, homemade curd, yogurt, fermented milk, fermented buttermilk, and then idli dosas. These are the probiotics that we have suggested, and the prebiotics where garlic, onions, bananas, which is semi-ripe, oats, and whole grain flax seeds. And we have suggested also the polyphenols, the green tea, dark chocolate, and then omega-3 walnut, flax seeds, chia seeds, fatty fishes if they are non-vegetarian. The fish with the fiber, vegetables, fruits, legumes, millets, the high fiber base for every meal. We have recommended them to stay hydrated. At least they have to drink 2 to 2.5 liters of the day of water. These are my Group D. And then let's move to demographic analysis. In this demographic analysis, we have included the categorical variables and then continuous variables. The gender was the categorical variables, and age, VO2 max, and heart rate was which is the resting heart rate, which is the continuous variables. For these categorical variables, I have used the chi-square test summary for demographic distributions. The interpretation over here is there is no significant, which is the P is greater than 0.05, which indicates clearly that gender is evenly distributed across the 4 groups. And then, so this is the basic graphical representation of the chi-square, where the chi-square distribution illustrating the comparison of gender distribution across the 4 study groups. This suggests that gender was evenly distributed across all the groups and supporting demographic balances for this variable. And we have used for one way and always used for continuous variables, where all the p values are above 0.05, meaning there is no statistically significant difference across groups for any of the demographic variables. This confirms that the randomization was successful and that the study groups were demographically comparable at the baseline. And then let's begin with the statistical analysis. The first table I mentioned was the pre and post values of those interventions. And then the second table is the T and P value of those interventions, where the calculated value is greater than the tabulated value, which indicates that there is a significant improvement within the group, where I included the Beck anxiety inventory T value and Beck anxiety inventory P value and quality of life T value and quality of life P value. Clearly you can see that the calculated value is greater than the tabulated value, which indicates clearly that there is a significant improvement. And then we have used one way ANOVA to compare all four groups, and clearly you can see the F value is greater than the P value, which indicates there is a significant difference between all four groups. And further we have calculated the mean value to find out which group is actually superior in all these four groups. By this clearly we can see that group A was the superior one, and then the second rank goes to group C, and then third rank goes to group B, and then D is the least one and it goes to 4. These are the graphical representations. You can clearly see the pre and post values. In pre-test the Beck anxiety inventory scores were high, and then after the post-test it was low, as well as the quality of life is less comparable to the post-test, and the quality of life also increased. These all for the each groups. The A group shows more significantly different in all the interventions, where these are my graphical representations. You can clearly see pre and post test, where for an A group the anxiety level increased in pre-test and then it got decreased to in post-test, and as well as in quality of life also you can clearly see. This is the only post values, post value interventions by group. And then statistically we are satisfied and we are eager to know how it works in the real world scenarios. That's why we have taken the Cohen's d summary, where the value of 0.8, which is assembled as considered as a large one, but the values we got here is more than those 0.8 value, which is very large. And then it was also significant in Cohen's d summary. These are the comparisons between the group, the post interventions for Beck anxiety inventory scale, and then this for the quality of life. These are the graph among all the group. The group A shows the significant improvement over here. It shows a significant differences. So group A is considered as a superior one. And then for further evaluation, we have used Pearson correlation between the Beck anxiety inventory and quality of life, the post interventions. By using Pearson, the rho is equal to -0.87, which is a strong negative correlation, which indicates as Beck anxiety inventory decreases, the quality of life which is increases. And the way I have also used this Spearman correlation, where the Spearman correlation between Beck anxiety inventory post and the quality of life post is rho is equal to -1.0, and then p value is 0.000. There is a perfect negative correlation between anxiety and quality of life ranks across 4 groups. As BIA scores increases, the quality of life scores decreases in perfect rank order. These are my rank orders, where the group A rank 1 in low anxiety and rank 4 in quality of life, which is the highest quality of life. These are my ranking orders that we all do in our Spearman correlation. These are the heat map. When the quality of life decreases, the anxiety that increases. When the quality of life increases, the anxiety get decreased. These are my heat maps. The result, this provides the compelling evidence that combining a progressive aerobic exercise regime starting with moderate intensity aerobic exercise MIA transitioning to the high intensity interval training, which is the HIT, the gut targeted psychopathic diet significantly improves the anxiety symptoms and quality of life among the adults with obsessive compulsive disorder, which is compared to control interventions. The greatest reduction in Beck anxiety inventory scores and the largest increase in quality of life scores were seen in participants who received both progressive aerobic exercise and the psychobiotic diet. The both exercise alone interventions, MIAE plus diet and high intensity interval diet, led to significant improvement in Beck anxiety inventory and quality of life compared to controls, but the progressive MIAE approach was most effective. The psychobiotic diet intervention alone without exercise produced a small statistically significant improvement, highlighted the supportive but limited diet role can play in isolation. The one way ANOVA confirmed statistically significant difference between the groups after the interventions, further validated by the within group parity test, which is all the p-values greater than 0.001. And then the result supports the clinical value of staged progressive aerobic exercise, particularly when paired with nutritional strategies that got targeted by axis. They added the benefit observed in progressive exercises as opposed to starting immediately with HIT or only using MIAE, such as the tailoring exercise intensity according to participants' readiness maximizes the both psychological resilience and adherence and insight, especially patient to adults with high baseline anxiety or compulsivity. The psychobiotic diet, by promoting favorable changes in gut microbiome, may amplify neurophysiological benefits through enhanced serotonin signaling and immune modulation. This study aligns with existing literature showing that both structured exercise and dietary interventions can independently impact mood, stress, and functioning. Being psychotic population or parallel RCT for design further demonstrate their combination may yield addictive or very synergetic effects with an important consideration for a holistic management of OCD. And then let's begin with the discussion. In discussion, what if I'm gonna tell you that there is a next big advancement in anxiety treatment isn't hidden in lab or in a bottle of pills, but in a pair of walking shoes and a bowl of fermented curd. This is a story of science and simplicity and hope. And even with the golden standard treatments like SSRI and CBT remain treatment resistant or only patients only partially get improved. So we asked, what if anxiety could be reduced and not just in mind but throughout the body and gut? And then let's acknowledge the truth. The SSRI, which is the selective serotonin reuptake inhibitor, help many people by increasing serotonin levels in the brain, but they don't work for everyone and side effects can be burdensome, fatigue, weight loss, changes, and emotional blunting. The worsen still SSRI does not increase the serotonin production. They just keep what's already there in the circulation. So what happens when the body isn't making enough serotonin to begin with? That's where the psychobiotic diet offers a complementary or alternative path. Instead of conserving the serotonin like SSRI, it increases the natural production of the starting in the gut. This gives us the more holistic approach inside out and bottom up. And then let's discuss about the gut brain axis and anxiety, EC cells, and tryptophan. Here how it works. In your gut there is a specialized cell called ectochromaffin cells, which is enterochromaffin cells, EC cells. They are responsible for the producing about 90% of your body's serotonin, the very neurotransmitter which is targeted by SSRIs. To function, EC cells rely on tryptophan, an amino acid found in protein-rich food and a fermented food. But a tryptophan needs a healthy gut microbiome to be converted into usable serotonin. That's where the psychobiotic and probiotics and prebiotic and gut supporting nutrients comes in. They help in maintain microbial balance, improving tryptophan metabolism and stimulated serotonin release. So while SSRI works at the reuptake side, the psychopathic diet works at the protection side. These are the differences between SSRI and the psychopathic diet. Together, they amplify the body's natural serotonin pathway and may reduce anxiety and more effectively, especially in the patients who are treatment resistant. And then these are the discussions of my studies and the conclusion. This parallel group OCD demonstrates that in adults with OCD, a combined intervention of progressive aerobic exercise and a psychobiotic diet leads to significant greater reductions in anxiety symptoms and improvements in quality of life compared to single intervention or control. The findings highlights the importance of integrating the both behavioral exercises and nutritional dietary, which strategizes adjustive therapies adjunctive therapies. Let's move to conclusion. The parallel group RCT demonstrate that the adults with OCD, a combined intervention of progressive aerobic exercise and the psychobiotic diet leads to significant greater reduction in anxiety and improvement in quality of life compared to single intervention or control. The findings highlight the importance of integrating both behavioral exercise and nutritional, which is the dietary one, and then strategizes the therapies in psychiatric care, which progressive intensity and targeted approach yield optimal outcomes. Larger studies with a longer follow-up or warranted to confirm the results were and examine the underlying biological mechanisms. The limitations and recommendations. The limitations: the only 20 subjects in each group, the short study duration. The study was lasted just 12 weeks. We don't know if the benefits will last longer. Not for everyone. This may we find not apply to children, older adults, or people with other illnesses. And then no biological markers measured, which are the gut microbiota changes, serotonin level, and inflammatory markers were objectively assessed to support proposed mechanisms. There is no full blinding was possible, might have introduced expectation bias. Recommendations: use more participants in the future studies and conduct long-term follow-ups, assess side effects, and include different ages, backgrounds, and health conditions. Find ways to help people to motivated to stick with the diet and exercises. Add more objective tests like blood or gut test, so understand the exactly how the interventions work. These are my references. Thank you.